So we identified 5 areas where the public charge rule can directly impact public health concerns, and how our recommendations for interventions and ways of responding to sort of minimize the repercussions of public charge. So one would be to ensure access to publicly funded health insurance to everyone, not just those who are documented, since this is an infection that affects everyone. And if there are really, the chain is only strong as the weakest link. And so if we decide not to provide health insurance to a certain population, it's only natural that that will allow the virus to continue to spread in those who are not able to seek the same care as everyone else. We need to stop detainment of immigrants that are seeking healthcare. Now, the UCSCIS stated that they would not try to arrest any undocumented immigrants who are seeking healthcare if it's COVID-19 related. That still presents 2 problems. One, if you have a fear of being deported by an entity for years, and then suddenly they say, we will not deport you if it's for this one reason, if we ask ourselves, do we think this group would suddenly feel as if they could, without fear, pursue care in this setting? Probably not. And that's some of the data that we're getting from, that we're collecting on undocumented immigrants who are seeking and not seeking care, is that the fear remains, even though there was a statement saying that they would not. The second problem is that there is the possibility of an undocumented immigrant seeking care for COVID-19 related symptoms, and then if the test is negative, how is that processed? Will ICE then consider that a non-COVID-19 care that was provided, in which case then they could attempt an arrest? For all of these reasons, the best option for making this, for allowing immigrants to truly seek care without fear, would be to just stop detaining immigrants for any reason, not just if it's COVID-19 related. And so that way it won't be put into force in such a way that may be interpreted differently by different groups. Number 3 would be eliminating the overcrowding of detention centers. So that's a well-known fact about infectious diseases. In areas where there's overcrowding, there is easy spread of the infection. The reason why, when you're asking a patient about tuberculosis risk factors, you ask about, were they in areas with overcrowding, such as shelters, such as prisons? These are all risk factors for tuberculosis. And it's not just tuberculosis, but it's any type of respiratory infectious disease, such as COVID-19, in which case we should really try to address this at the root cause, and that would be stop the overcrowding, eliminate the placement of undocumented immigrants in these detention centers. We need to dismantle the Remain in Mexico program. The thought is that these people who are seeking asylum need to be in Mexico as they wait for their trial. However, if you look at it as that those who are seeking asylum actually do meet the criteria and they belong here, we don't see how that is fair to have to wait in another country where they don't have any contacts, and that is actually protecting the public health with them waiting there, since there was no reason to suspect that they were COVID-19 positive in the first place. And so that would be another demand that we think that should be enacted. The as well as providing emergency funding for neighborhood clinics. Neighborhood clinics are the backbone of healthcare delivery for undocumented patients. And it's really important that they receive funding, because if they have to close their doors, there are not many options where undocumented immigrants can turn to without having the fear of ICE knocking on the door. And so those are some of the demands that I think that we're making, so that really can impact on not just making life easier for undocumented immigrants who provide the workforce for a large number of our industries, but also at the same time protecting public health and everyone in the surrounding communities. I wanted to express my particular concern about the number of deaths that I believe are avoidable to coronavirus, especially among the Latino population and other people of color. We look at the data. So Latinos aged 35 to 44 have a mortality rate 8 times higher than their white counterparts in that age group. I can't think of another situation where the disparities are that great. If I could show you on a graph, it'd probably be a little bit more obvious, but these numbers are hugely disproportionate. We have this inequity persists with age groups 25 to 34 and those 45 to 54, according to this new Harvard analysis that came out of the National Center of Health Statistics that showed the huge differences from 8 times to 10 times among these different groups. A new Brookings Institute analysis showed that the coronavirus is killing Black and Latino adults in their mid-30s and mid-50s at levels 6 to 10 times higher than their white counterparts. Approximately 1 in 3 low-income immigrant families with children are going without public benefits like health coverage, food stamps, because of fear of public charge. That's an increase from just over 1 in 5, which was last year's numbers. So before it was 1 in 5, now it's 1 in 3. Over 1 in 10 said they avoided housing subsidies. Some adults reported avoiding public programs that are not listed in public charge, including free or low-cost medical care programs for the uninsured. That was 21% in the survey. The SNAP program, 16%. Marketplace health insurance coverage, 14%, and free or reduced price school lunches, 13%. These are not part of public charge, but they were avoided because of the fear that it might be included or that it could be associated with those programs that are included in public charge. Also, avoidance of these programs is particularly worrisome in families with children because the entire family faces the financial hardships, the psychological distress, and problems in accessing healthcare if it only affects one person. It then trickles down and eventually affects the entire family. Nearly 80% of adults surveyed didn't know that their children could enroll in Medicaid without affecting their parents' legal status. And so that's an example of how the children suffer, even if they're documented, if the parent themselves are non-documented because of the fear. And it's sort of a problem that if you affect one person, you're affecting entire family.
I would say that the impact has varied from the first 2 months of COVID, the fear and the anxiety. Not only did we already have that because of public charge, but also the unknown. I think even us, you could say your average person was very concerned of just what exactly was COVID, et cetera. I think for our immigrant community, not only was it just the fear overall, but also the information not being provided in different languages. It did take here within Illinois a few weeks to provide the information even in Spanish. Unfortunately, when it comes to media, it still has not been provided in other languages. Some of it has been provided in Chinese, Arabic, and I believe in Urdu as well, to my knowledge. So that has led to immigrant serving organizations having to do a lot more outreach and education, translating materials, not only on a topic that they were not familiar with, but also just that added burden that they already had in trying to address the issues. So I would say lack of information, was one, and to add that was the language barrier. The other one, when it comes to the fear, is not only of the unknown, but also, again, similar to other places in the country, is them being, the majority of immigrants being uninsured. Not only undocumented, but overall, whether it be because of the cost or whether it be because their employer does not offer insurance. So there's been many studies showing how not only was the fear preventing individuals from getting tested because of public charge, but also because in the beginning they didn't know that the testing was free, for example. And it wasn't until much advocacy that we were able to get our governor, Governor Pritzker, to publicly say that testing was free for everyone, regardless of insurance and regardless of immigration status. I think to add briefly to that is also the concern of treatment. We have been hearing from both a couple of different local public health professionals and doctors that unfortunately when it comes to the Latino, as well as to an extent the Asian community, they end up showing up to the hospital with more serious symptoms than other individuals. And we think that it's, again, the combination of the fear of immigration, public charge, as well as the cost. And I would say lastly, because our undocumented community, the majority, over 70% of them, do live in mixed status families, it's also that dynamic of some US citizen relative may not seek certain care because they don't want to expose the undocumented individual. So I'm not highlighting, you could say a lot of, you could say new facts, but just really want to emphasize that unfortunately it's similar barriers that we have seen in other things. And I would just say that the public charge rule has really further exposed the discrimination and the racism and everything within our public health system, as well as just overall the impact in our community. The new public charge rule, not only does it give permission, authorization to immigration officials to predict, literally to look in the future, based on an individual's current skills, current income, assets, etc., and be able to pretty much predict if that person is going to ever in the future end up relying on the government for any kind of public benefit. And what I mean by skills is they are looking now after February 24th, which is when the rule took effect, the person's education level, income level, credit score, if they have assets, family size, health, if they have health insurance, etc. So it changed just the overall how an individual's immigration application gets examined. And the two groups of people that are mostly affected by this rule are those that are trying to get a visa to come to the US, either adjust their visa, either from a student, for example, to a worker's visa as one example, or those individuals that are trying to get a green card, either going from a visa to a green card or undocumented to a green card.
It's been clear that the pandemic's health and economic impacts have fallen hardest on communities of color, including immigrant families. Unfortunately, what we've seen is that coronavirus legislation that's been enacted so far doesn't go far enough to help immigrant families, and it's leaving millions without access to essential programs. So as we continue to advocate for more immigrant-inclusive legislation, we want to make sure that families are aware of the programs they may be eligible for right now. So I'm going to briefly review eligibility for healthcare, cash assistance, food assistance, and unemployment insurance. And before I start, I just want to flag that this eligibility information is also available in the form of a quick reference guide on our website at protectingimmigrantfamilies.org. We have the quick reference guide available in both English and in Spanish. So first, let me talk about healthcare. On healthcare, our message to immigrant families is that it is safe and smart to seek testing and treatment for COVID-19. We encourage everyone, including immigrants, to seek the care that they need during this difficult time. Federal legislation has provided funds to healthcare providers, including community health centers and hospitals, to cover COVID testing and treatment of uninsured people. immigrants can continue to access healthcare services at community health centers regardless of their immigration status. We do advise that before going to a clinic, people should call and ask about the availability of COVID-19 testing in advance. Eligibility for health coverage programs like Medicaid, the Children's Health Insurance Program, and the Affordable Care Act marketplaces has not changed at this time. However, if individuals are uninsured, especially if they've recently lost coverage through a job or if they've had a significant decrease in their income, we strongly recommend that they meet with a health insurance navigator so that they can understand what their options are for health coverage moving forward. Unfortunately, as Luvia mentioned in her remarks, we are seeing evidence that immigrants are afraid to access medical treatment for COVID because of public charge and concerns about potential immigration consequences. It's really important that we spread the word that testing, treatment, and preventive care related to COVID-19 will not be included in a public charge determination, even if the healthcare services are covered by Medicaid. Additionally, we want to make sure that immigrant families are aware that healthcare workers should not be asking them information about their immigration status. Hospital emergency rooms and community health centers will provide treatment whether or not someone has insurance, money, or immigration documents. It's also really important to emphasize that information that people provide when they're applying for health coverage or when they're seeking medical treatment, that information is not shared with immigration enforcement officials. Next, I want to talk briefly about cash assistance. Under the CARES Act, most people earning less than $75,000 a year are eligible for a one-time cash payment of $1,200, and that should be issued automatically. Married couples should each receive a check, and families are eligible for $500 per child. Unfortunately, right now, there is a Social Security number requirement that excludes many immigrant and mixed status families from receiving this stimulus payment. If one partner in a married couple filing jointly household uses an I-10 number instead of a Social Security number to file their taxes, no one in the household is eligible for the payment, including their children, even if those children are US citizens. So for those who are eligible for the stimulus payment, one thing that's important to know is that receipt of the stimulus payment is not taken into account in the public charge determination. So that means that receiving the stimulus payment will not negatively impact someone's ability to get a green card in the future. Next, let me talk about food assistance. Eligibility rules for SNAP, or also known as food stamps, has not changed at this time. But we do want to spread the word about a new nutrition assistance program that is now available in over 40 states. The program is called Pandemic EBT, or PEBT for short. And PEBT provides nutritional resources to families that have lost access to free or reduced price school meals during school closures due to COVID-19. Families who are eligible for PEBT will receive those funds directly on a new or existing EBT card to help fill in the school meals gap. For many immigrant families that have been excluded from unemployment assistance and stimulus checks, PEBT may be the only new resource that's available right now to help them weather this very challenging time. So we hope that you will help us spread the word about PEBT and make sure immigrant families understand that there are no immigration status requirements to receive PEBT. And also to let them know that PEBT is not considered in the public charge test. We definitely encourage families whose children were receiving school meals before schools closed to see if their state has implemented the program. Finally, I want to talk about unemployment insurance. For people who have lost jobs, unemployment insurance may be available to them. The CARES Act expands unemployment insurance in several ways, including providing coverage for independent contractors, and also extending the length of time that people are eligible for unemployment benefits due to COVID-19. Unfortunately, under our current unemployment system, undocumented workers are not eligible for federal unemployment benefits. The general rule is that workers need a valid work authorization in order to be eligible for unemployment benefits. Now I want to pivot and talk just a bit about some state and local help that may also be available. What we've seen is that in recent months, several states and localities have really stepped up to provide greater and more equitable access to programs for immigrant families. One great example is in California, where Governor Newsom announced the California Disaster Assistance Program. This program provides help to undocumented adults who are ineligible for federal assistance and who have experienced a hardship as a result of COVID-19. An undocumented adult in California who qualifies can receive $500 in direct assistance with up to $1,000 of assistance per household. And that state funding is expected to reach about 150,000 undocumented adults in California. There are a lot of other amazing examples of programs that are specific to certain states and certain cities. So we encourage immigrant families to reach out to local nonprofits and to legal services organizations in their area to find out what may be available and what the deadlines are to apply for programs. Finally, to close, I just want to highlight again that all of the eligibility information I shared today is available on our website at www.protectingimmigrantfamilies.org. While we continue to advocate for more inclusive federal policies, it is really important to make sure that families are applying for the programs that they may currently be eligible to receive. At the Protecting Immigrant Families campaign, we are grateful to have more than 450 partner organizations in over 40 states that are doing outreach and education to immigrant families and are really dedicated to ensuring that everyone has the resources that they need to thrive during the pandemic. Student loans and student federal financial aid is absolutely not considered in the public charge determination. So students who are eligible for that financial aid should continue to apply for and receive it to make sure that they are able to attend their higher education programs. The general rule is that workers must have a valid work authorization in order to receive unemployment benefits. To your other question, receipt of unemployment benefits is not considered in the public charge determination. So individuals who are eligible for unemployment benefits should absolutely apply for them without fear that doing so is going to cause harmful consequences if they later apply for a green card.
While there has been some federal relief overall, it does not go far enough. Recently, the House passed the HEROES Act on May 15th, which is a critical step towards a pandemic response that protects all of us. And the Republican-led Senate has not prioritized moving forward on providing relief for the past several weeks since. So here at NILC, as co-chair of the Protecting Immigrant Families campaign, we've been urging senators to take action quickly and to consider provisions that halt the public charge regulations that allow immigrants in all states, and particularly those with low incomes, to receive COVID-19 testing, treatment, and vaccines, particularly through emergency Medicaid, to remove barriers to nutrition assistance and other supports, to protect immigrants from enforcement at healthcare facilities and other sensitive locations, and to ensure that language access is not a barrier to care and support systems. And we're prioritizing these asks just for a number of reasons. You know, as number one, immigrants and their family members should not fear, right, that they will be penalized or placed at risk for seeking healthcare and other needed services during the pandemic because of public charge. We need to provide no-cost testing and treatment for all in order to fight this pandemic, regardless of people's immigration status or the state where they live. As you've heard from Madison, there's really been a piecemeal approach in terms of trying to ensure that all of us get some type of coverage. And we are really calling for leadership at the federal level. And as I mentioned, we want this coverage through emergency Medicaid because emergency Medicaid is actually not factored in the public charge test. 40+ million people are out of work and struggling to pay their bills. And previous legislative fixes have specifically denied immigrant and mixed immigration status families from the stimulus payments themselves. And so we need to provide cash payments to individuals who file their taxes with an ITIN and create a process for those who are not required to file taxes but are otherwise eligible. Next, I think we just need to ensure, as Dr. Turner-Llovera said, we need to ensure that immigrants and their families feel safe in entering the facilities themselves, like healthcare centers. Currently, there are no provisions in any previous bills that prohibit U.S. Immigration and Customs Enforcement, or ICE, from conducting immigration enforcement at these sensitive locations. And lastly, people just need to understand what's going on and be able to access information about their healthcare and other options. And we cannot make lack of language access a barrier to one's ability to learn about the availability of and their eligibility for healthcare and other services. And this is particularly important given that in the US, more than 25 million people are limited English proficient. So just in closing, to take a step back, I just want to reflect on the growing movement for Black lives and the growing hate incidents and violence for against Asian Americans and Pacific Islanders because of the president's statement, right, calling COVID-19 most recently as the Kung flu. I would just I think I would characterize our current political moment as a convergence of two pandemics, the health pandemic as one, and the other pandemic of anti-Blackness and racism, when considering its disproportionate impacts and discrimination on communities of color. Our communities really, and you've heard it today, have been and are profoundly affected by the pandemic. We're actually at the epicenter of those who are infected and dying, those who are unemployed and excluded from relief, and there's a disproportionate number of us that are essential workers. We are also at the epicenter of the pandemic of anti-Black police violence. And so the Trump administration's immigration policies continue to terrorize our communities, and the result has been a toxic brew that hurts all of us, regardless of where we are born. Systemic inequities have really glaringly been laid bare by COVID-19 as a function of white supremacy. And really, we believe that our current healthcare, police, and economic support systems do not serve our country. So we should get rid of them and put into place changes that ensure that everyone, regardless of where they were born, has access to economic support, healthcare, and other basic needs that really allow all of us to thrive. I've seen, for example, guidances that come out from at the state level as well as the county and city level, really that talk about how these services are available to undocumented immigrants, et cetera, and they should feel safe in entering these facilities. But I would say that has not been across the board. And so, one of the pushes that we're making at the federal level is for the passage of something called the Sensitive Locations Act, right, which would actually create a federal standard protections to be instilled. There's only at this point just guidance at the federal level, but nothing really beyond that when it comes to some of these protections. And what we've been hearing specifically at border communities is that ICE agents still, enter some of these facilities anyways and chill immigrants from accessing their healthcare.